All right, she's becoming a star, ladies and gentlemen. Dr. Kristin Anderson is joining us here in the studio yet again, and they just keep sending you back because we haven't mined everything there is to mine out of you yet. So,
well, there's just so much in the world to talk about. Let's just get started.
Are we doing the astrology and health today? Is that the focus?
So the first question that I have.
The stars say. Anyway. First, let me look at your palm. Anyway, right. But first of all, welcome back.
Thank you so much. I love being here.
In all seriousness, school just started.
Right.
And there's a lot going on. I know that there are required immunizations that kids have to have in order to be registered for school. They don't have them by now. It's, school's been in session for a couple of weeks now.
Right.
So what are the ones that the kids have to have and ones they should have?
Well, I totally recommend that people talk to their doctor about the recommendations that they have for the kids, because it's individualized. There are a certain set of standards that need to happen, but that conversation, it's good to have that conversation with your doctor and go over that. They're certainly the best way that we can keep our kids healthy and free from disease. There are other things that you can do, but vaccinations are an excellent way to protect our kids, including the flu vaccine, which should be coming out here.
It's out.
It's out. It's ready to go.
I did a story about that last week.
Oh, good. So usually by the end of October is when you really want to get your kids immunized, and sometimes there's a little leeway in the fall, but it's okay to just get on board and get going with that.
Okay, I got to ask a question. On the flu vaccine. All right, so I'm one of these people that gets told every year to take the flu vaccine, and I usually don't.
Oh.
I'm sorry. And it's not because I'm afraid I'm going to get some chemical and die or get autism from the flu vaccine.
That's good.
It's because
you won't.
I've watched my family members get the flu vaccine. They usually don't get a flu virus in the year, but when they take the flu vaccine, bam, they're out for like 2 weeks.
No.
I've watched them. And so like my wife, who's go-getter,
sure.
and she has to get the flu vaccine because she's in the health field.
Right.
And so, it just lays her out. And I'm like, man, if that's the slight symptom.
Well, one way to look at it is if that's what happens to you, first of all, you cannot get the flu from the flu vaccine. It's not activated.
It's because it's a dead vaccine.
That's right. That's
okay.
right. And so it's stimulating your body to make antibodies. You're not getting the flu from it. A couple things that I think happen. People get the flu vaccine at the time of year when it might already be circulating. So you may have already contracted it before you've gotten the vaccine. The good news is, and what I was going to say is that if you have the vaccine, you still get the flu because it's not 100%, but your symptoms might not be as bad as they were if you didn't have the vaccine at all. So if you think you feel sick, just imagine what it'd be like if you didn't have the vaccine at all. But you cannot get the flu from the vaccine.
Okay.
The other thing is, I think it also is, it's the time of year that kids are starting to get colds and flus anyway. So some of the symptoms are hard to distinguish. You might just be sick anyway, having nothing to do with the vaccine.
Well,
you can't blame the
No, here's the other thing. There's people out there.
It's just a shot. You can do it.
I can maybe do it.
You can do it.
I don't think you were here when I
just look the other way, John.
Just sneeze.
You weren't here the last time we talked about John's medical adventures. It involved dizziness and almost fainting. I looked like Hillary Clinton when I was in the hospital there.
Yeah. Anyway.
But to take it one step,
it's a personal matter. Okay.
To take it one step forward.
You don't need to know.
There's a lot of people like me, I think, that grew up eating dirt and chasing bugs.
And those are good things.
And running around and traveling a lot and being in airplanes and being in school and busy places. And like I just never get sick. How many times have I taken off sick, Peter?
Never, as far as I know.
That's right. And I'm with you. I don't get sick either. So that's nice. That's good. But we do want to let our bodies do what they need to do. But the reason that the flu is such a topic is because people do die from the flu, especially vulnerable populations. It's, we can blow it off probably, but for younger or vulnerable elderly, it's a serious disease and it's a deadly disease. And also, if you think about maybe taking time off of work or the impact, as a working parent, I think, it's okay for her to get sick. Just please have it not be tomorrow because I have something to do. And there's always something to do. So I think if you can protect your kids from illness, and especially the vulnerable ones, not only is it the right thing to do for your family,
well,
but for others.
one of the things, we just came off of summer, and now we're in school. The kids are smushed together in classrooms.
Right. Yep. They're sharing everything.
They're having much closer contact with kids. They're
Right.
playing. They're at the playground. They're doing doing recess, playing tag, or whatever it is they play.
Snack
I don't know
time,
what they
the whole
play
thing.
anymore. So they're touching each other. There's
That's
a lot
right.
more contact. They're touching, scissors and crayons and pencils and chalkboards and all
boxes
that.
of germs.
Yeah. So there's germs out there. So it's important to keep your kids inoculated. But I understand that there are some things for teenagers that we need to think about as well. Some, especially for teenage girls, right?
That's right. To protect from HPV, and we don't think of cancers down the road as an infectious process, but there's an infectious, what we say, etiology to that, and so there are ways to protect our kids from that early on before you even think about it. So if it's one of those things where none of us think that we're going to die, right? But we are. It's going to happen.
Is that human papillomavirus? Is that what it's called?
That's exactly right.
Thank you.
So
I get my star for the day.
10 points in sexually transmitted disease. Credit to Peter Christian.
No, it's not a sexually transmitted disease.
HPV isn't it?
It is, and that's why.
Oh, I didn't know that.
You
I'm
get
sorry.
minus 5 points for not knowing you're sexually transmitted disease.
I blew it. Go ahead.
But it's one of those things where if you can protect your kids from something down the road, that's a great thing to just take on and do it and go for it and move on to other things.
Now, can I ask one? This is a real serious one.
Okay.
Now, what about hepatitis? I know that teenagers. I've seen some really horrific public service announcements of kids that get hepatitis and they didn't get vaccinated, and
Right. So hepatitis B, there's also a hepatitis A vaccine. All of these are vaccinations that if you can protect yourself, this is the best way that you can to protect ourselves from certain diseases. There are some things we can't protect ourselves from, and we're in an absolute race to try to create some vaccines for them nationally. And, we all wish that there was Zika. But the things that we can do to protect ourselves, we certainly talk to your doctor and get those vaccinations.
Casually referred to comment earlier has sponsored a comment on our Facebook page. Katie says, Hillary was diagnosed with pneumonia and given antibiotics. Isn't bacterial pneumonia transmittable? And shouldn't she have had a pneumonia vaccine since she is over 65? Is that something people can get?
Well, I first of all, as a professional, I wouldn't diagnose somebody by seeing what happened to them on TV. I also don't know her relationship with her doctor or what vaccines that she's had. So again, highly recommend that people get the vaccines that they are recommended to get based on age or risk factors.
Now, hypothetically...
Yeah. Shifting gears again.
Oh, we have lured her in. And Katie, thank you for that well-placed. Because I actually just closed circuit. I asked her about the pneumonia thing, Dr. Anderson. When she came in, she goes, well, I'm not really
I
knew
it. I knew it.
Anyway, tell you
I knew it.
what,
Yes.
we're up against
Okay.
a break, so we're gonna just take her off the hook here for a second. 72112. But she is the doctor in the room. By the way, if you have questions or comments about anything we've talked about so far, or questions about keeping your kids healthy for a school year, like not falling off the monkey bars would be a good thing.
Yes, Naomi.
Yeah, we're going to be right back with more of Health Talk with Dr. Kristin Anderson. Our number is 721-1290. Stay with us. They're all chuckling. Hit me with your best
That's
shot.
Right. Here we
Get
go.
it? Okay, I'm here all
believe
week.
we had
All
that.
right,
Thank you.
sorry. Okay, 721-1290 is our number, 1-800-568-5309. You got your headphones on? Let's get Mark on the line. Mark, you're on with Dr. Kristin Anderson. Hi.
Hey, this whole STD vaccine conversation reminded me of a couple of things we've heard from doctors. We've been told that girls that get these STD type vaccinations seem to be showing more stomach issues and other ailments versus the girls that haven't. Do you know anything about that?
The data that come out on the vaccines, if it becomes a recommended vaccine, are clearly in the camp that there is benefit to giving the vaccine and preventing disease down the road. So in terms of specific specifics, if you could help me with a study or something like that, and we could talk about it.
No, we just have a daughter who's had some digestive tract issues and acid reflux problems, and as we've taken her to a couple of doctors, that was one of the things they've asked, is if she's had that vaccine, which she hasn't, but she said, the doctors have said that the girls who have gotten those seem to have more of those types of issues.
Interesting.
But we didn't talk studies or anything.
Wow.
And I think it's important to talk about that. So, and the fear that some people may have about that, talk to your doctor about them and see specifically what it is, and then have a conversation and see what it's all about. But I wouldn't guess about it, or I don't want to speculate, because I think those things can feed into fear that we don't need to have.
Oh, I agree with that. I was wondering if you'd heard anything or if it's been your experience or not.
Thanks for the question.
Thanks, Mark. Have a good day. All right, 721-1290 is our number, 1-800-568-5309.
So seriously, though, real quick to follow up with Katie's question, is there a pneumonia vaccine?
There is, yeah, right. So to go back to that, there's a series of them. Again, depending on risk factors, it changes when you get that. You might get it earlier than 65. I wouldn't look at her, diagnose her. Not appropriate for doctors to do that. I think that it's just something that is between her and her doctor. Pneumonia is something that people get, especially if they're run down, and it's a treatable disease. So
yes, but can it, if it's not treated properly, can it just keep recurring?
Well, you can have it where maybe it doesn't go away, or you need to change your antibiotics to fit the bacteria that's causing the disease in the first place. But I don't know about a recurrence necessarily. It's really, again, when I was talking about the flu, we're talking about really vulnerable populations here. So populations that I tend to see more frequently or very young. That's when we really worry about it. But in general, people bounce back.
But it is manageable.
It's absolutely manageable.
Okay.
Yep.
Looks like Jim has an experience kind of similar to mine. He says, I know 2 young, healthy people who are only down for 3 to 4 days when they catch the flu in the wild, but have been incapacitated for 2 weeks after getting the vaccine. I'm not an anti-vaxxer, but that's not encouraging to me.
Yeah, again, you cannot get the flu from the flu vaccine. So it may have something to do with, when you got it.
So it's a timing thing that they might be having the flu.
And I do hear this, but I think, again, this is exactly what you were saying. People are going back into there's snow. I can see it on the mountains right now. The seasons are changing. Our behavior is changing. We're in closer quarters. We're going to the malls for school shopping, and wherever we're going. And you're going to get sick during the year. It's going to happen. Adults get 2 to 4 colds a year. On average, kids get more. It happens. It's okay. Our immune systems are built to handle that. Again, the flu is a separate thing because it can be deadly.
So when it comes to sending our kids into that test tube of bacteria we call a school.
That's right. And viruses, too. Don't forget those viruses.
What do you think of as, some precautionary measures other than
aside from a bubble,
other than getting the shots before you send them in?
I'll tell you what I want to do is put my daughter in the thing that the black box on airplanes. I just want to put her in black box material all the time. I don't see what's wrong with
the
that.
one that even a crash can't destroy.
Right.
Right?
That's what I want her in. But
just hold your breath, honey.
I can't. I give her the things that we're all
It's a little cramped, but it'll be okay.
Sorry, you might have trouble on the playground.
Whatever happens, you'll be the one to make it out.
But since we can't, you just have to do the common sense things that probably your mom told you to do, but you may not do. So you need to eat a healthy breakfast. Studies show that a healthy breakfast helps kids, throughout the day. They score better on tests and activities. And not that that's the important thing only, but, a healthy breakfast gets kids off to a good start. Hand washing is also really important. Encourage your kids to wash their hands before they eat, after the bathroom. These are common sense times. I'm not encouraging just slathering yourself.
Well, let me ask, do you think because I know going into any hospital, you go into any hospital room, there's a hand sanitizer. That's like required, right?
Well, part of that has to do with the fact that even doctors are to blame, and make sure that you watch your doc and make sure that they wash their hands. We've known about how diseases are transmitted for a long, long time. but people are busy. You don't think about it, but
Thank you, Dr. Jenner. Yeah.
we all need to take responsibility for hand washing, so that's part of it. But also visitors bringing into, especially these vulnerable people that you're visiting in the hospital, you don't want to add to whatever it is they're dealing
the
with.
question I was getting around to is, do you think that teachers should have one of those on their desk in every classroom, just in case if people want to use it?
You know, I think that's something that I'm guessing you probably need to send with your kid. I imagine that there are probably issues with putting that. Some people don't want it.
Sure.
And just to bring up another subject, unfortunately, there are kids that, there's alcohol in these hand sanitizers.
Oh, that's right. Yeah.
So it's not, nothing is benign.
Interesting.
Right.
Wow.
Yep.
Well, I'll have to check that out.
So we have another show in a couple weeks.
Hopefully Peter will still be with us.
Okay, we're up against a break. 721-1290 is our number. Dr. Kristin Anderson joining us here this morning from Community Medical Center from Day One. This is Health Talk. We'll be back in just a moment. One more doctor song here for you. We don't have very many. I have to use whatever I have.
I have a special list. I love it.
That's right. Anyway, 721-1290 is our number. Dr. Kristin Anderson joining us here in studio. She's one of our favorite people from Community Medical Center.
You.
We love having her hang out here with us.
Good
You want to stay with us from 9 to 10? We'll have some more fun.
Let's do it. Let's bring it on.
You're on.
Hey, one of the things that I know you wanted to talk about a little bit is starting at kindergarten, moving on up. The kids start they have to have a backpack, carry books, all sorts of stuff. So we need to make sure that they don't get overloaded, right?
That's right. So just if you're going on a pack trip, you don't want to overload your backpack, and you don't need everything out in the mountains. Same thing for the kids. And they don't need that kind of stress on their skeletons and on their back and everything. And it's not a good habit to get into. So trying to make sure that they're not overloaded with everything. If they can leave something at school, they do, and
you
just bring home what they need.
The Encyclopedia Britannica
they don't
should
need
not
to take the whole set home.
Okay. And some clever person invented the internet.
I was just going to say, I think the homework has changed since you did it.
Well, maybe not.
No one's chiseling stone tablets anymore.
And the fire on the cave. Yeah,
that's great.
We're in trouble. But I would and also make sure that they put both straps on their little backs. They don't need to sling it over their shoulder to look cool. Do things that,
so you displace the weight evenly.
That's right. That's right. And also, I think this time of year, don't forget, it's so important to keep those little kids active. I think pretty easy at recess, but don't forget how important it is to keep moving. Exercise boosts your immune system, since we've talked about immune system so much. And also, make sure that you have healthy snacks. It's really easy to hand something that's packaged in the middle of the aisle, like we've talked about before, but you can also just, give the kids an apple or a banana or something that comes in its own natural package, but might be a little bit healthier.
Yeah. And hopefully they eat that banana before you find it
before
at the bottom of their backpack.
Of the heavy backpack we were just describing.
Right. Don't put that Encyclopedia Britannica on top of the banana.
I can find your backpack because I can smell that 6-week-old banana. It's still there. All right.
What about kids and sports and after school activities? You got any recommendations for?
Anything that they enjoy doing, especially in the younger ages, we recommend that activity. And we've talked about how important physical activity is. But get them into the sports that they like to do. I wouldn't recommend forcing them to do it because it's unlikely to become one of those healthy habits we've talked about. But healthy activities, healthy food, and establish good homework habits. All these things. The earlier you get the have to work done, the easier it's going to be down the road.
Okay, so we have less than a minute left in the show. So give us some contact information if folks want to get in touch with you, because you're an internist, right?
I'm a family doc.
Family doc.
Yep.
Okay. All right.
And if they want to talk to their doctor, I would say call 728-4100 or on the web, communitymed.org. You can look at the docs, and if you don't have one, get hooked up with one, or they can help you find one and go from there.
This is interesting because I know with the Affordable Care Act, there have been can I get a doctor? Can I find a doctor? So do you have openings? Let's put it this way.
Absolutely. There are openings for people to come and see their doc if you're looking for somebody. And, studies show that if you have a primary care physician, you're likely to be healthier overall and get the care you need.
If I like you, I can keep you?
But only
I'll be
in
here
a
next
black
week.
box.
That's
Black
right.
box.
The thing from the airplane. That's right.
Well, Dr. Anderson, it's always a pleasure.
Thank you so much. I enjoyed it.
You're a delight to have, and you put up with us. I don't know how she does it. Anyway, and they keep sending her back. Are you in trouble?
I must have done something
Someone
wrong.
might not have washed their
No,
hands
no,
and got caught.
All right.
There are cameras.
And I promise to stop drinking the Purell. Okay. And